Welcome. My name is Karen Ansell. I'm with ACBS Insurance Services. For the past 36 years, I work with Medicare recipients, and insurance companies that specialize in insurance for seniors. Today, we're here to discuss the Medicare Options for 2025 and how Medicare works for you. We want to thank you for attending the educational webinar on Medicare. One of the main reasons I'm here today is because my clients and you have gotten incomplete information and false information over the years, and we're going to try and make it Medicare made clear. Many of you recognize these stars on these commercials. These commercials run constantly during annual enrollment period and throughout the year. But you need to know that these stars will not be your insurance agent. They have their own personal insurance agents. You also get very official looking mailers such as Medicare and Social Security. They're not from Medicare and Social Security. They just want you to call the 1-800 number. You get constant phone calls, emails, and even coming to your home, knocking on your door. So today we want to explain your options, and so that way you will have enough information to make a wise choice for your individual needs. ACBS Services has a national presence. We also have great customer service. We pride ourselves on our customer service. Many times when you join an agency, you get filled out the application and that's the last time you hear from them. We instruct our clients to call us if they have an issue with a doctor or hospital or insurance company, and we'll help them with their claims. We also contact them in September for the next annual enrollment period to make sure they're happy with their insurance, to see if any changes in health. We are licensed with over 100 years of knowledge and experience, and we represent over 50 different companies because we're totally unbiased. We just listen to what you're looking for, what your needs are, and then we help you make the right choice. A little disclaimer is we do not offer every plan available in your area. Any information we provide is limited to those plans we do offer. You need to call 1-800-MEDICARE or go on to medicare.gov for additional information. Today's topics, we're getting started with Medicare, the 2025 changes in Medicare, Medicare Part A, which is your hospital, and Part B, which is your doctor's insurance, Medicare Part C, which is the Medicare Advantage plan, and Part D, which is your prescription drug plan. We're also going to discuss Medicare supplements, or Medigap, same word, which pays the co-pays and co-insurances that Medicare does not pay, and talk about Medicare Advantage plans, which is an alternative to Medicare that covers things that Medicare does not cover, such as dental, vision, over-the-counter, transportation, and much more. Getting started with Medicare, you can apply for Medicare after 24 months of being on disability or having end-stage renal disease or Lou Gehrig's disease. You must be turning age 65, and you must be a U.S. citizen in order to get Medicare. You can apply 3 months before your birth month, the month of, and 3 months after your birth month. If your birthday is on the first of the month, your Medicare will be effective the first day of the month prior. If your birthday's not on the first of the month, then it will be effective the first day of your birth month. If you're drawing Social Security, you will automatically be enrolled into Medicare. If not, you can enroll on ssa.gov or call Social Security or apply at your local Social Security office. Many people are continuing to work past age 65, and they have an option to stay on to their employer coverage or choose Medicare. So if you do decide to stay on your employer coverage, there's special forms that you'll need to fill out. And you can apply for Medicare Part B or Part A and B 3 months before you want to retire. And you can apply anytime throughout the year. There can be a 10% penalty for not applying for Medicare when you're first eligible. So you want to make sure that your employer coverage is what they call credible. And you want to make sure that the benefits and the premium is best to stay with your employer coverage, or it might be best to go with Medicare. We help you make that choice. We get a list of your benefits with your employer coverage and the cost, and then advise you whether it's best to stay there or to look at going on to Medicare coverage. So we're going to start with original Medicare. Medicare started in 1966, and A and B is all they had until 2006. Medicare Part A cost $0, as long as you worked at least 40 quarters into the Social Security system, or you may be on your spouse's Medicare. If you go into the hospital under Medicare, the first to the 60th day, they want you to pay $1,632. It's not a one-time calendar year deductible. That 60 days is very important. It's called a benefit period deductible. So if you go in the hospital, for example, 5 days, you're responsible for $1,632. If you come out of the hospital, and if you're out for 60 or more days and you go back in, you owe it again. So 60 days between stays, I owe it again. If you're in the hospital longer than 60 consecutive days, you go into the second stage of Medicare Part A. You will be responsible for $408 per day. The 91st or the 150th day, you're responsible for $816 per day. And after 150 days, Medicare stops paying. The second part of Part A is skilled nursing care. You have to be in the hospital for 3 consecutive days in order for the skilled nursing care to kick in. This is like in a facility, and it's intense rehab, get you better, get you home. My dad just got out of rehab. He was in there for 3 weeks. He had back surgery, so it was intense rehab, got him better, got him home, and then we continue with home health care. So the first 20 days in a rehab facility are free. Medicare pays all costs. The 21st through the 100th day, if you're still in that rehab facility, Medicare wants you to pay $204 per day. And they get a total of 100 days. Home health care is covered under Medicare, but it's not long-term care at home. They will come in, administer drugs, change bandages, and then they're gone. You pay $0 for home health care. Medicare Part B is the second part of original Medicare, and this is where most of your dealings with Medicare is going to come from. It's not just your primary care doctor, but it's also all your specialists. It's in the hospital or outpatient. So if you're in the hospital, it's surgeon, assistant surgeon, anesthesiologist, pathologist, radiologist, consultation fees. It's MRIs, CAT scans, PET scans, things like that. It's also medical equipment, wheelchairs, walkers, hospital beds, all of the testing as well. Medicare Part B costs $174.70 per month. If you're drawing Social Security, it will be taken directly out of your Social Security check. If not, they will bill you quarterly. At that time, you can go on to Medicare.gov and set it up on a monthly basis if you wish. Now, Medicare, again, is $174.70 per month, Part B. You could pay more for Medicare. It used to be whether you were Bill Gates or you were middle class, you paid the same amount. In President Obama, when he was in, he came out with what they call IRMA, Income Related Monthly Adjustment Amount. And what this is that if your income is above a certain amount, you will pay more than the $174.70. And that is a sliding scale. The more you make, the more you pay. So Medicare Part B has a one-time annual deductible of $240. Once you meet that, Medicare will then pay 80% of what they approve. And you will be responsible for 20% of the approved. And then you see the plus the 15% for non-assignment doctors. We know it as in-network and out-of-network. Medicare calls it taking assignment and non-assignment. So I'll show you an example. We have an actual doctor's bill of $1,150. Medicare is approved $1,000. So Medicare then pays 80%, not of the actual, but of what they approve, or $800. So you are responsible for the 20% of the approved, or $200. If the doctor takes assignment, that's all you owe is the 20%. If he does not take assignment, he can charge an additional 15% above the Medicare approved amount. Or in this situation, you can see $150. Now they passed a law, which is really great, that states that the maximum a doctor can charge above the approved amount is 15%. So on this particular bill, by law, he could not charge $1,151. 15% is the maximum. And also, so important, Medicare must approve the charge in order for any Medicare supplement to be paying the balance. So very important, the charge must be approved by Medicare. So we just talked about Medicare A, hospital, skilled nursing care, and home care. Medicare Part B is all your doctor's services, testing and medical equipment, and much more. So we're going to show you now, you saw your liabilities. We're going to talk about two options that you have under Medicare. The first is a Medicare supplement or a Medigap. That's the same word for the option one. You can choose from 10 different Medicare supplement plans, and they're from A to N plans. They do have a monthly premium associated with the plans, but you pay very little out of pocket when you need to use them. You would need to add on a prescription drug plan, and you can choose any Medicare approved provider, any doctor, any hospital you wish to go to, as long as they accept Medicare. You can change plans all year long, which is very important. You don't have to wait for the annual enrollment period to change Medicare supplements. So if your premium's too high, or if you'd like to look at a different benefit on Medicare plans, just give us a call and we'd be happy to help you. Medicare Option 1, we're going to talk about two different Medicare supplement or Medigap plans that are available to you. The Plan G, you pay the $240 deductible. The plan pays the 20% of the approved, plus excess fees that are not approved by Medicare. The Plan N is also a very good plan. You still pay the same deductible, the $240, but you will have a $20 office visit, whether it's primary or specialist, and a $50 emergency room copay, which will be waived if you're admitted to the hospital. Then it will pick up the 20% of the approved. And Medicare must approve the charge in order for any plan, Medicare supplement plan, to pay. Prescription plans are changing in 2025 due to the Inflation Reduction Act, or IRA, which made several improvements to Medicare Part D prescription plans, which can be a standalone plan or embedded into your Medicare Advantage plan. These improvements mean the insurance company will incur higher costs, which means you may have higher premiums and copays. It is so important you compare plans for 2025, which we are here to assist you with. The Medicare Part D, the 2025 Part D changes are big and will be a major plus for a lot of members. The donut hole or gap goes away. The new Part D out-of-pocket limit is $2,000 is the maximum you will pay next year. There will be only 3 stages for 2025 instead of 4. And there will be a new Medicare prescription payment plan called M3P. Medicare Part D, again, this first stage is the deductible stage. Members will pay 0 deductible or as high as $590. Once you pay that, you'll go into the stage 2, which is the initial coverage stage. Members will pay a dollar amount or a percentage until their out-of-pocket costs reach $2,000. In stage 3, the catastrophic stage, members will pay nothing, 0. The Medicare prescription payment plan is called M3P. It's a new program that provides Part D members the option to pay out-of-pocket costs by monthly payments over the course of the plan year instead of all at once at the pharmacy. This plan can definitely spread out your costs through the year. Most people with higher drug costs will benefit from this program. You can initiate this by calling your prescription plan, or during the year, the company may call you if they see this might benefit you. This will be a separate charge from your premium. Again, you will no longer pay at your pharmacy. You will pay a monthly amount directly to your prescription plan, which can fluctuate throughout the year. There is help with prescriptions. Each state has a low-income subsidy, or LIS, which helps pay premiums and copays. This is based on income and assets. You can also get help from pharmaceutical companies and drug assistance programs. This is based on your income, and your income can be actually much higher than for the low-income subsidy program. Option 2 is a Medicare Advantage plan. They're called Part C. These insurance companies are approved by Medicare, and they're called replacement programs. They have star ratings. The star ratings are 1 through 5 star ratings. Most plans are a 0 premium, so you save the premium that you're paying on a Medicare supplement, and prescription drug plan is normally built right in. They cover Part A hospital, B doctors, and prescriptions. Drugs are built right in. They have additional benefits such as dental, vision, over-the-counter benefits, hearing aids, transportation, and more. So this is, again, where an agent should be listening to you. Many of my clients don't drive any longer, so this transportation is wonderful for them. They have an out-of-pocket maximum that you could possibly spend in 1 year, and they have a choice of HMOs and PPOs. And we represent most of the plans. These work very similar to an employer plan. If you think about now, if you're on an employer plan, you have co-pays and co-insurances, a network of doctors, and you have an out-of-pocket maximum. They work very similar to these types of plans. Another type of Medicare Advantage plan is what they call a chronic plan, or a C-SNP. These Medicare Advantage plans that provide treatment for people with chronic or debilitating illnesses. Conditions can include diabetes, lung disorders, cardiovascular disorders, and so on. They're designed to help people manage their care and include all the benefits of original Medicare, and also have a Part D plan automatically built in. And most of them do cover the dental and vision and over-the-counter and much more. Another type of Medicare Advantage plan is called a D-SNP, a dual eligible Medicare-Medicaid plan. And you have a couple options when you go on to Medicaid and Medicare. You have the MMA plan, which is managed care that's offered through ACA or the state, or you can do a Medicare-Medicaid Advantage plan. These called D-SNP plans. You will either have an HMO or a PPO. HMO requires referrals. PPO does not require referrals to see a specialist. These plans are those who have some form of Medicaid, and we represent most plans. Medicare and Medicaid plans, or D-SNPs, dual special needs plans. This is one of my favorite plans. We have zero copays for all approved doctors, hospitals, and prescriptions. You have up to $350 a month, which is loaded onto a Visa card. You can use this for over-the-counter items such as vitamins, cold and allergy medicines, or blood pressure cuffs. You even get healthy food at your local grocery store, or you can use it for utilities. It pays for transportation and a gym membership. You get up to $4,500 a year in dental and $3,600 for hearing aids, and up to $550 for glasses and zero co-payment for emergency response systems, which you can wear around your neck or wrist. 28 delicious meals after a hospital or skilled nursing home stay, and much more. We're going to talk about enrollment periods. We have your initial enrollment period, which when you're first going on to Medicare. The annual enrollment period, which most people know about, is when you can compare plans and change plans. This is from October 15th through December 7th, with a January 1st effective. We have OEP, or open enrollment period. This is for those who have a Medicare Advantage plan only, and you can change from January 1st to March 31st one time. SEP stands for Special Enrollment Period. There are many different types of special enrollment periods. If the company has 5 stars, they can offer the plan all year long. If you have Medicare and Medicaid, you can change during the year, or if you leave employer coverage, or move out of the service area, and many more special enrollment periods. ACBS Insurance Services. Let me ask you, would you rather work with an agent that represents 1 or 2 companies or many companies? Everyone's needs are different, and one company cannot meet everyone's needs. For questions or additional information on Medicare and your options, please sign up below for your no-cost consultation.